So Fadi, if you think back to December 2024, I guess the majority of your work would have been focused on the Northwest when it came to Syria. So tell us about the work that you have done afterwards and the reach you now have across Syria, and your plans to support Syria and Syrians across all geographies going forward.
Yeah, hi, Ola, thank you. After December the 2024, we could not do much in the new areas of Syria, like Daraa, Homs, Damascus, Qamish, Zur. The reason for that, because there was no funding, very, very minimal funding. Everybody was waiting for the announcement, which was only happened last week for America to lift the sanction. So this was the biggest obstacle and biggest restriction for us to start doing real effective work. But since December, as Dr. Muhammad knows more than me, we've submitted over 60 projects, mixed between health, WASH, education, to our international partners, and we are waiting for approval. And hopefully, this time, after lifting the sanction, our work will be much different, because I feel this is the first time we, as a humanitarian organization, we not led by any political decisions. Unfortunately, for the past 14 years, it was shocking for me that most of the decision wasn't based on humanitarian principles, was based on political decision. But now, hopefully, we're going to see a different. Thank you.
Fantastic, Fadi. That's really, really important. And there is a follow-up question here, perhaps either to yourself or to Muhammad. So this is around, what does the collaboration with the new Syrian government and this new Syrian Minister of Health, many of you will know that he's been in position since the start of April, and also now with some of the other local organizations that you may not have worked with before, but also some of the international NGOs, and how do you avoid duplication and fragmentation? Muhammad, perhaps I can ask you this, and if Fadi would like to add anything, we can go back to Fadi.
Yeah, thank you for your question. Just like I will start from where Abdurrahman mentioned, that's the fragmentation of the health cluster system, or the health system in northwest Syria. It was based on somehow cluster approach, which is like providing like separation between the sectors. We are dealing with the human beings, so we need to deal with the whole like cycle together and somehow. Currently, I mean, like, if we go back for the health system blocks, I think the governance is the most important one somehow. And we be like in this era now, just like because we have the government, we are work closely with the government, and this is really important. Just like not only for avoiding the duplication, but also to build the system in a right way. We need to put a stone and know that this stone will stay forever and somehow. And this is really important to work closely and somehow. Now, for example, if we will do like any kind of infrastructure rehabilitation, it's wrong to have like NGO go directly for that facility and do it. Maybe there is like another facility in other area. It's more priority for the people. For example, now we are trying to help the people to go back from the camps area to the area of origin, and to need to focus in rehabilitation of those facilities. It's more like important to do the rehabilitation for maybe facilities. It's like the people already have access for the health space in other area. So the coordination and to have the government and the head of the table and somehow, and to draw the map and somehow, and to lead this effort for the coordination is really important in this stage. So totally agree that we need to cooperate as much as we can, and to focus and to fill the gaps and to follow the priorities of the health of the health ministry and the health directorate, of course.